So in terms of rotator cuff tears, it's a very common problem for many people, particularly in our middle to later ages of life. Our rotator cuff tends to wear out over time, and occasionally we have an injury or a fall, and that creates a complete tear in the rotator cuff. So this is a model that I have here. The rotator cuff is actually 4 large muscles and tendons which help elevate and rotate the arm. It allows you to get behind your back, to put your billfold in your pocket. It allows you to reach up and reach something out of a cabinet. All of these daily things that we don't think about until there's a problem. And so if one of these rotator cuff tendons is actually torn like this, then oftentimes we have to go in and repair these. I am able to utilize minimally invasive arthroscopic techniques to repair the vast majority of these rotator cuff tears. So we no longer have large incisions where we're tearing the muscles in the shoulder in order to go and repair the rotator cuff. This affords people a little less pain post-operatively, and frankly, it just looks a little better. We also have great new technologies that have only come out in the past 5 to 10 years. Previously, we bring the tendon back over with some sutures and we tie it back down to where it belongs. Now we have the option for some patients that we're able to augment this with a biological healing adjunct that allows the rotator cuff to heal smaller tears and oftentimes prevent progression of disease. I'm one of only a handful of surgeons here in East Tennessee performing this procedure, but for the right patient, it can be an absolute game changer.